President Mateki?
Okay. So let's see if all the board members are back. I know John will be jumping in at 1:30.
Right. Yes, that's correct. I need to step away at 1:30 for a work call, but
Oh,
I'll be back. I'll be back after I'm done with that.
okay. We will start if you are here. Okay. Shall we take a roll call or it's okay?
Let's go ahead with what we've been doing and take the roll call, please.
Okay, let's do that. Christine, take the roll call. Yes. Great.
Sure. Dr. Amy Mateki,
Yes, present.
Kitman Chan,
Yes, present.
Yongping Chen,
Yes, present.
John Harabedian, I heard you earlier.
Yep, here.
Francisco Kim,
I'm here.
Chudong Lee, okay. Ruben Osario, so it looks like maybe they're not back. But we do have a quorum to continue. I don't know if you want to give it a little more time.
Maybe shall we just start it and then if they come in, just let us know. We can, let's just go ahead and start, I think, with the item 25.
Certainly, Madam President, I can go ahead and start on the messaging of the new fees. If you please turn to item 25, the memo there. It's a brief messaging, so I'll go ahead and read it and then go over the increases. Effective January 1st, 2021, new acupuncture fees will go into effect with the enactment of Assembly Bill 3330, Calderon, Chapter 359, Statutes of 2020. The board has not raised fees in over 3 decades and has been addressing its budgetary structural imbalance for the last 7 years, culminating in an independent third-party fee study conducted in 2019 that reported revenue losses amongst all of the board's fees. The increase in fees is necessary at this time for the board to avoid insolvency, align its revenues with its expenditures, and eliminate this structural imbalance. Doing so allows the board to continue licensing and regulating acupuncturists for the protection of California consumers. And then the chart you see there below are all the fees included that are being changed or instituted. Here we have the exam fee for acupuncturists going from $550 to $800. Likewise for the re-exam fee, $550 to $800. The application fee for the examination was going from $75 to $250. Foreign trained applicants, because of the additional workload on confirming their transcripts, their fee is now $350 in addition to the exam fee. Initial certificate for an acupuncturist has gone from $325 to $500. The renewal fee from $325 to $500. The delinquent renewal fee was at $25, and should the Section 100 not go through on the delinquency fee and statute and regulation, then it will stay at $25. Should it go to should the Section 100 go through, then the delinquency fee will move to the maximum that BPC and Christine, there's a Business and Professions Code that has a maximum of $150 or half of the licensing fee, whichever is less. And so this will move the delinquency fee to $150. As you saw, we did have a number of delinquencies in the last quarter. Now, the numbers that we did review, that Mr. Hurt did provide, do also reflect what the situation of the pandemic as well. So we know that some licensees cannot renew as readily as others. The replacement pocket license, that is going from $10 to $50. The wall license registration is $50. The wall license replacement and renewal is going from $15 to $50. The endorsement for a license, or otherwise known as a license verification, is going from $10 to $100. CE provider fees are going from $150 to $500, as well as the renewal fees for CE providers, which is every 2 years. There is now a CE course fee of $10 per CE hour seeking to be offered. The tutorial fees are also increasing, and this was one of our most costliest programs to run. The application fee for the acupuncture supervisor is dropping to from $200 to $100. They are instructors providing their time to train trainees. The annual renewal for the supervisor is going from $50 to $200. The application fee for the acupuncturist trainee is going from $25 to $1,000. The annual renewal for the acupuncturist trainee is going from $10 to $500. And then the delinquency fee for the trainee is going from $5 to $100. And for the supervisor is going from $25 to $50 for a delinquency fee. That concludes the reasoning behind the last few years of actions, as well as the chart summarizing the fee changes that will be happening January 1st of 2021. Any questions from the board? We have talked about this to a great extent so far, so I'm not surprised that we don't have any comments, but it does sound like our stakeholders certainly do. Madam President.
Yeah, I appreciated the update, and I know throughout the day we've been discussing this issue of this item. I will open up to the board members. I think I said a lot already, and I'm sure we will hear from the public too. So let's open up to the board members. Thank you, Ben, for explanation, and I totally understand this is not a desired topic, and none of us wanted to discuss this in this year.
Madam President, I have no questions, and I'm going to be signing off now for my call, and we'll see you again shortly.
Okay, thank you. Thank you, Chair.
Madam President, we've also been informed that Shudong Lee has returned. Member Lee, if you would kindly confirm.
Yes, I have a little trouble with the login last time. Reconnect.
Welcome back.
Yeah.
Thank you.
Thank you.
And Member Kim is also here.
Okay.
Mr. Kim, would you confirm? I'm not sure if we caught you on the roll call there.
Yeah, I spoke that I was present, but I got cut off, so I just came back.
Thank you, sir. Please proceed, Madam President.
Yes, so let's just open up to the board members, and Member Kim, you'd like to add? I see your hands raised, please.
Yes, I as a board member who's been involved in this fee increase and also all this sunset review process, and then looking back all those board meetings and hearings and all that, like I said before, there's a missing part, which is from the licensees, or they would call them as association, and now they're coming back with all this input, and in some parts, I feel I'm like pleased that they're coming back to give us input. There's so many meetings so far, and we have to work out. I remember one time Ben asked me to find out any missing out association, in this licensee community, and we had to reach out to them and ask for their input or ask for their opinion on this fee increase. Now, as you can see, the record of all these board meeting minutes and even the videos, not a single opposition or any comment. But now they are really outraged by this. So for one part, I was very surprised and saddened that because of this scattered association licenses and but in other part, I'm glad at least they are here. But I hope because I was involved in unifying the association to represent the licensees, but I think it's still going on. But at least we hear at least your voices, all these licenses voices. So I would be happy to accommodate all this input. But like I said, we can work on some other changes in the legislature in the future. But we have to, I think at least hear more of their opinions and all this, especially have some attentions from the other licenses, not the individuals, but those individuals form a association and form small association groups, make a bigger association group, so that there is a licensee voice present in all these procedures. That's what I understand now, this situation. So in part, I'm glad that we are hearing something. Okay.
Any other board members? Thank you, Member Kim.
Madam President, can we do a check to see if Member Osorio has returned?
Okay, sure. Please.
Member Osorio, have you returned to the meeting?
Yes, I have.
Excellent. Thank you.
Thanks.
Let the record reflect that. Thank you.
Yeah, thank you. So I guess no question from the board members. No comment. Ben, if you're okay, we shall open up to the public.
Please.
Okay. Moderator, please open up to the public. Thank you.
You're very welcome. This is the moderator. I have opened at the discretion of the board, the public comment. If you would like to make a public comment, please type, "I would like to make a comment," and send to all panelists. All comments will be addressed in the order they are received. You will be given 3 minutes and provided a 30-second warning. With that, our first individual is identified as Dylan Stan. Your microphone has been unmuted.
Hi, everyone. I hope you're not tired of hearing from me. Before I sum up what we've been saying, I just want to respectfully put forth that it's not feasible for providers to listen to every meeting recording or read every board meeting minute. The board has the contact information of all providers, and I would suggest and put forth that the board, can send an invitation to all of us if there's going to be a meeting that has, significant and sweeping changes like this. So if we had an email saying, there's going to be a board meeting, please attend, this is going to affect all of you and the future of continuing education in the industry, we would all be there. So, to sum up what we've said, the continuing education providers, Pacific College of Health and Science, eLotus, Healthy Seminars, formerly Prodi Seminars, and Net of Knowledge, formerly Eastern Currents Learning, have all come together and written a joint letter to the California Acupuncture Board. This letter is in response to the board's recent actions in regard to Assembly Bill 3330. And I please ask each board member to take the time to read this as soon as you can after this meeting. As industry stakeholders and some of the larger providers in the field, we see a very big concern Our concern is not with the new $10 per hour course application fee, nor with the biennial provider fees increase. We fully agree that that is needed, and we're glad that the board finally has implemented a fee system that will allow it to be sustainable, because for so long it was not. Our concern, however, is with the lack of a bulk discount renewal fee system for already approved distance education courses. Because as it stands, every course will require a full new application fee each time and each year. This will result in unrealistic fees. For some providers, it'll be $3,000 a year, $5,000 a year. In our case, it's $9,000 a year. In the case of others, $30,000. Of course, that's just not going to be paid. You know, we're happy to support the board, but that's not going to happen at that level. So businesses like us instead will pivot, will have no choice but to drop many hundreds of valuable courses. And that's going to mean, one, teachers and practitioners will lose money and will end up even more financially vulnerable than they already are. Number two, the knowledge sharing of the industry will be hindered, and the library of knowledge available to the California practitioners will be significantly reduced. Number three, smaller providers will not be able to establish themselves. The implementation of a bulk discount system for renewals, like the NCCOMs, is fully in line with Section 4970. I've listed my points before. If I have an opportunity to comment again after this, I can share them again. It's also written in the letter, but I know it's probably hard to follow here. But the board has full flexibility and full jurisdiction at this point to work with the current legislation. Thank you.
Our next public comment comes from Neil Miller. Your microphone has been unmuted.
Thank you. Members of the board and the public, I first want to apologize if during the previous board agenda item I was a bit emotional. It may be that this issue gets my emotions up. It might be part of the pandemic blues, but if I was a little forthright beyond reasonableness, I apologize. The fee increases, Ben, the staff, the board, they did a great job addressing the fee increase issue over the past several years. CalAtma is and has been in full support of all of these fee increases. We have been at all of the meetings discussing this. We have listened to all of the proposals, and we still are on record today supporting all of the increases. And we have done a huge job trying to explain to our members what it is and why all these increases are necessary, with the exception of the wall license. So if you look at the percentages, there's a lot of increases, and you did a great job. There is one area that is an absolute failure, and it's not about the amount of money at the $50. It's that this is not proper. It was not properly noticed, and it will not even come close to achieving your goal of protecting the public. Both Stacy Nelson Hicks and Michael Fox in previous comments were very clear in this not achieving your goals. It will achieve a lot more. I believe that there are other people who will agree with me not to pay, which is going to make and use their pocket license. Many offices have closed. Many people are doing house calls now as to supplement their income. Many people are doing the telehealth, as was mentioned, and this $50 fee will do nothing to achieve your goals. During the course of the last 20 minutes, had I had the skills, I could have made a duplicate license, and I could have given all the public members a license. I could have made out a license for the governor. I could have made Ben Bodea a license. It's easy for somebody who is a bad actor to take advantage of the system. And the system that you have in place charging this extra $50 is not going to resolve that. And as I stated, this really has to do with prostitution and keeping track of people and people not abusing their license. Those people who are going to abuse it, they're going to abuse it anyway. You have to go after them, not go after every single other acupuncturist. The percentages of statistics and data don't make this a realistic change. So there's a lot of things you did great, and there's one that is not, and that we are going to try our best to work with you and with the government to resolve this. Thank you.
Next, we have Todd Luger. Your microphone has been unmuted.
Hi, I'm Todd Luger, and I'm the Director of Lifelong Learning for Pacific College of Health and Science, which is the home of Pacific College of Oriental Medicine and also the Pacific Center for Lifelong Learning. Pacific Center for Lifelong Learning is where the college delivers its continuing education from, and that is what my comment is about. With regard to the new fees that you have applied for the continuing education process, I want to agree with Dylan Stan's previous comments that we are, as a group of providers, but Pacific College specifically, are quite happy with the new provider fee and the new course fees. We think they're a long time coming, and we completely support the board implementing these fees so that they can be a sustainable operation. We do, however, take exception to the fees for the previously approved courses, which were approved in good faith on both sides as if they were never to expire. Now we are being asked to renew those courses once a year. And the renewal fee for those courses, as Dylan Stan has mentioned a couple of times, is quite onerous. Pacific College would, rather than paying the $75 per year that we currently pay to the board, which we agree is too low, would now find ourselves paying more on the order of $8,000 or $9,000 a year to the board. Obviously, this is a significant change in our bottom line. But more importantly, because this is really about public health and safety and the benefit of the practitioners, if we have to pay this large fee annually to renew all of the courses in our catalog, we will have no choice but to reduce the number of courses available to California acupuncturists. These courses will, however, remain available in our stores, but they will be indicated as only being eligible for NCC AOM points and not California CEUs. This will deprive California acupuncturists of courses on interesting and important, although sometimes possibly less popular topics. And it will be the courses that sell less that will be removed from the catalog in California. It will also deprive teachers of these courses, many of whom are licensed acupuncturists in the state of California, of their share of the ongoing revenue at a time when many of them have seen their revenue in their clinical practices decline. That's all I have to say. Thank you for giving me the time to speak.
Next, we have an individual identified as Lauren Brown. Your microphone has been unmuted.
Thank you, Lauren Brown, founder of Healthy Seminars. Again, I concur with the points that have been made by Todd Luger and Dylan Stan. I want to just address some of the board comments and just make note into the minutes that when this item was brought up, there was some laughter heard by the board members. I do hope that is laughter of nervousness, that you've realized there might have been an oversight and this is an uncomfortable conversation, and not that you're laughing at us and you're going to dismiss anything we are commenting about. There was a comment by one of the board members that they can't contact us. It's our responsibility. I would say that the reason you have not heard a lot until now, point one, it only went out on Wednesday, December 16th, this new change. Point two is, if there is going to be a significant change, I believe it is up to the board to contact the significant stakeholders. Just like you sent out the email on December 16th, that same type of email to all your providers could have been done much earlier during the discussion process. This leads me to another point. Since you're implementing a renewal process, please discuss with your stakeholders, your providers, what this is going to look like. Unfortunately, bureaucracy kills small businesses, and your licensed acupuncturists are small businesses, and your providers are small businesses, and you are bureaucracy. So when you do your renewal process, it could be a waste of your own resources if we have to send in a whole new application again for courses that have already been approved, sending you the identical paperwork, the same PDF version, and it will waste our resources to have to keep renewing this. The points made already by some of the other providers. We think it's reasonable that you have a $500 fee. We want the CAB to be a going concern. We want you to be solvent. We think it's reasonable that you're charging for new course applications. 781 courses I heard in the first quarter, times how many hours? We see that your $500 biannual, your every 2-year fee, and your new course application fees, that will be a great funding revenue stream for the board. However, we do not think it's reasonable to have this renewal fee to courses that have already been approved. It looks like, in substance, like a cash grab. And we are requesting that you revisit this because it doesn't look like it's based on legislation, as in the way it's written, the board does have administrative ability to have a special rate for the renewals. And it's already being done, and your providers here, who are also providers of the
30
NCCM,
seconds.
who are also providers of the NCCM, have been agreement and living with this bulk rate. The NCCM doesn't do it by hours for the renewal, it's based on courses. And if you can model after that, keep your $500 fee, keep your course fee for new courses, and then model after the NCCM, I think this will work for all. Thank you.
Next up, we have Michael L. Fox. Your microphone has been unmuted.
Thank you. This is Michael L. Fox. I practice in Los Angeles. I am going to support our CEU providers, and I'm going to say this. If we are being asked to pay extra money for this process, it doesn't really seem to protect the public. You guys can easily include the CEU providers on your email list automatically. You can easily provide a bulk rate to them. If we are talking about California Health Series and the stalwart providers in California, Brody, Healthy Seminars, and Evergreen. I'm sorry, they have it's Lotus, I think. We need to support them, and what's going to happen is these courses are not going to be sustainable, and California acupuncturists are not going to be able to take these courses and support and protect the public, because we go forth and we take these classes at our own expense and for the public's benefit. And here you are going from $150 to, in some cases, $9,000 or $30,000. Why is this happening? This doesn't seem to be realistic. What we're looking for is some basis for us to consider and continue our continuing education in order to protect the public, and at the same time to do that at a reasonable rate. To charge us $10 per hour when it doesn't cost you anything different for an 8-hour course or a 6-hour course or a 2-hour course. What is that difference to you? It means that the consumer, meaning the providers, are going to pay an extra $80 or $160 or an extra $20. We're going to pay these random extra fees to sustain our continuing education providers.
30 seconds.
And then we are going to pass that along to our patients, and our patients are going to pay for that because you guys, as Lauren Brown has said, are looking for a cash grab. So what I am saying is make it a flat fee, and let's revisit this in regulations, and let's absolutely take this down to a more reasonable level. You've gone overboard here. Thank you.
Next, we have an individual identified as Donna Chow. Your microphone has been unmuted.
Thank you. My name is Donna Chow, representing Lotus Institute of Integrative Medicine, eLotus, and I'm here in unison with other C providers, Knowledge, Healthy Seminars, and Pacific College. Considering current courses at eLotus, our provider fee will increase, as mentioned, from $150 to more than $30,000 every other year. We believe that the new provider fees are reasonable. However, concern is implementing the fees towards course renewals as well. After reviewing the California Business and Professions Code, Section 4970, we believe that the Acupuncture Board has full jurisdiction to implement a separate fee structure for the renewal of previously approved distance learning courses without the need for any changes to the existing legislation. Currently, there is a lack of separate system for course renewals, which shows to be unrealistic and damaging to teachers, practitioners, the industry, and the public as well. This concern is urgent as it will result in a sudden loss of education for the industry and financial losses for teachers and practitioners. This will trickle down to a loss for the public and the safety of the public because it is important for practitioners to be able to have access to continuing education that will expand their knowledge and have them to be able to learn as much as possible to better help their patients. Limiting this ability can be public danger. We urge the board to put our letter on the agenda for the next meeting, and we urge the board to also come up with a separate bulk discount system for course renewals similar to the NCCAOM. The ability to do so is fully in line with the legislation. Thank you.
Madam President, we are done with our first round of public comments. I have been notified that there are individuals that would like to make second comments that are relevant to agenda item number 25.
Madam President, this is Fred Chan, UDCA Legal. I'd just like to point out that I certainly heard the previous public comments, and I do understand the concerns. However, I'd like to point out that the language in AB 3330 does mandate that these fees are required by law, and is not something that can be passed via it's not a fee that is imposed by regulation, but rather by statutory by statute by the legislature, and that the board does not have any discretion in setting the fees for those fees that are mandated by AB 3330.
And if I may specify, the statutory language provides the board the authority of only working within $10 as the fee floor and $20 as the fee cap, and the authority is set at $10 without regulation. Therefore, the board has to be within the $10 to $20 range in its regulations.
And I also just like to add that the language of AB 3330 is available on the LegInfo website, and the public can certainly go there and take a look at that language.
Thank you.
This is the moderator. Would you like me to continue?
Yes, please.
So now into the second round comments. First up, we have an individual identified as Dylan Stan. Your microphone has been unmuted.
Hi there. Thank you. Thank you, Fred, and also Ben. I will respond to that in just a moment, but I will start by saying that we have reviewed fully that piece of legislation. So let's talk solutions. I'm fully in agreement with Lauren, Todd, and Donna. This is a big deal. But there's a lot that the board can do. So we propose that the board adopts a bulk discount system for course renewals, separate from new course applications, providing a structure similar to the NCCAOM. So for example, they charge first 50 courses, $750, next 100 courses is $1,000, 200 for $1,500, and 500 courses, they cap it and above for $2,000. So a system like this would allow CE providers to continue to offer these courses in an affordable way and deal with all the concerns and the problems that would arise if not addressed. So we understand that the board is restricted by the legislature, but we actually, like I said, have fully reviewed it. So, paragraph 1 of subsection N reads, actually, I'm not even going to go there. I'll start with the entire section, Ben, that you just referred to. Section 4970 begins with the text, and you referred to the floor and the cap. This section reads, the amount of fees prescribed for licensed acupuncturists shall be those set forth in this section unless a lower fee is fixed by the board in accordance with section 4972. Unless a lower fee, so it can go lower than the floor. At 4972 says that fees fixed by the board shall be set forth in regulations duly adopted by the board. That means that if the board sets a regulation, and in this case, a regulation that is dealing with the renewals and a process for bulk discounts and a system that currently doesn't exist right now, if you create that, which we're proposing, that would be a regulation that allows for the fees to be lower than $10 an hour, in this case for course renewals. Moreover, in addition to that, really clear point in the law, paragraph 1 of subsection N, which you continue to cite, it refers, I think you even have some flexibility there. It refers to course applications. It doesn't mention renewal fees. We think that that's an opportunity
30 seconds.
right there. And also paragraph 3 of the same subsection, an approved course may be offered for a period of 1 year from the date of board course approval. It does not actually mention what occurs after the 1 year period is finished. It does not strictly mention that a brand new application must be submitted. We believe this provides a second, in this case, a third point of flexibility for the board to have a bit of flexibility and determine what occurs after the year is complete and to implement a separate system for course renewals. Thank you.
Madam President, this is Fred Chan, UDCA Legal. Just want to point out, I'm taking a look at AB 3330, the language of that bill regarding the continuing education provider of the floor rate, and it does say $10, and I don't exactly quite see the language where the previous commentator just stated. But from what I can see right now, looking on the Ledge Info webpage at the AB 3330, the section in question, that's what it says. Fees for continuing education course applications shall be assessed to the continuing education provider at a floor of $10 per hour of continuing education requested to offer and a cap of $20 per hour of continuing education requested to offer, allowing up to a maximum of 50 hours to be approved per course application. So I just want to point that out.
Thank you.
This is the moderator. Should I continue?
Yes, please.
Next, we have Lauren Brown. Your microphone has been unmuted.
Thank you. 2 points. First, I just wanted to bring up the point here that we do hope the board will allow credit card payments instead of sending in checks. I want to address just the comment that's happening with respect to our lawyer, Fred. Our focus here today is not to do the legal discussion. Our point here is to say that it looks like there is interpretation here, and that it is not just black and white law, and that there is an opportunity for interpretation. We are here to help find a solution, and we wanted the board to address this, to take this into deep consideration, not during this meeting alone and come up with a solution saying we're not going to do it or we are going to do it, but to sit back and look at this. With this, the legal document, I'm not a lawyer, you are the lawyer here. We want you to really look at this. From what you just read, that reads to me that that is for new course applications, this $10. We don't see anything there that specifically talks about renewals. They never had a renewal fee. They were just approved. All of a sudden now there's this shift. So it seems like it could be interpreted that you're applying this now to renewals as well. We're saying it could be, it looks like it's open for interpretation, and we would like the board with your legal team to review this if you think this is going to serve the profession, your members, better, which we have shared why this would be better for the board and for all its members. You're still going to generate your revenue. We want you to be solvent. We want you to be a going concern. And the fees that we'll be paying for new courses on an annual basis will be able to fund the CE division, we hope. And there's still fee from renewals. We just don't think it could be it's a $10 an hour renewal fee. We're looking for, and we suggest a solution, giving it a bulk rate. And so we want the board to be solvent. And the only part we're asking you to revisit is the renewal part. And when we read these documents that you're sharing, these legal documents, it does appear to be room for some interpretation for the board and gives the board the ability, the privilege to make some of these changes with respect to renewal. Because
30 seconds.
The paperwork appears to read about new courses, and these are not new courses. Thank you.
Next, we have Todd Luger. Your microphone has been unmuted.
Thank you. I'd just like to follow on the comments of Lauren Brown and Dylan Stan. And with respect to the, the off-the-cuff legal analysis that we're hearing here as we raise these issues, I understand it's challenging to do that. We have read this closely, and it appears to us that, as the others have stated, there is some room for interpretation in the narrow area of courses that have been previously approved. I have not found in any of the documentation a specific reference to fees for previously approved courses or renewal fees. Although it is clear that the board could, within their jurisdiction, implement the new course fee to previously approved courses at the end of each year, it also seems to me that the board could take a more lenient approach and give us a bulk package that would be affordable for us, again, because this is what is in the best interest of the public and the practitioners, as one of a licensee commenter mentioned. California acupuncturists will be deprived of a significant amount of the continuing education opportunities that will remain available to those in the 49 other states. That's all. Thank you.
Next, we have Donna Chow. Your microphone has been unmuted.
Thank you. This is Donna Chow with eLotus, and this is to address what Dylan Stan said about the fees. And in Section 4970 of the Business and Professions Code, as added by Section 4 of Chapter 308 of the Statutes of 2019, is amended to read: the amount of fees prescribed for licensed acupuncturists shall be those set forth in this section unless a lower fee is fixed by the board in accordance with Section 4972. So that's where you can find that information. I believe the lawyer was looking for it and he said he didn't see it in what he was reading. That is all. Thank you.
Next, we have Michael L. Fox. Your microphone has been unmuted.
So I'm just going to reiterate something. Legally, it seems to me, Fred, I'm sorry, I don't recall your last name, but the attorney representative, the law says unless the board approves a lower rate, and it is within the board's purview to approve a lower rate. We desperately need better education. We as licensed acupuncturists desperately we're not desperate. Our patients are eager to have our expertise. We want to help our patients. We want to improve our results. And when we are deprived of these education opportunities offered by companies headed by Lauren Brown and Dylan Stan and Donna Chow, we suffer because you make us suffer, in the sense of we're requiring you to have these CEUs, but our patients suffer because we don't have this education. I do a lot more education than I ever get credit for, and most of our acupuncturists spend a lot of money getting education that they never get CEUs for or NCCAOM credits for. We love to learn, and the fact that you, Fred, say that gosh, this is not germane, this is not legal. I'm concerned about that because the board apparently has the right to have some leeway here. And frankly, we need our CEU providers. We need the Lauren Browns. We need IDG. We need all of these providers to help us be better acupuncturists so that we can protect the public. And when you add all these extra costs on, we're just going to pass them on to our
30 seconds.
patients who at this time in COVID pandemic times are not going to be able to afford it. So alert yourself to this. Thank you.
At this time, there are no additional requests for public comment. Would you like me to close this feature?
Yes, please.
Feature has been closed.
Thank you. So I appreciate the stakeholder and public participation with this discussion. It is a very hard topic. I think all the board members today have learned a lot through this process. It is never easy, and everybody take it very serious. As we mentioned yesterday, everybody have a hardship here through this year. So we hear what you have brought to the board here today. So let me see. I see there is some hand raising. Is it Jay, Mr. Hurd? You wanted to add some? Please.
Yes, Amy. Yeah, I have something to say in terms of this one. And I'm just trying to offer some perspective, particularly in terms of distance learning. As we've been listening to this discussion, I have queried a number of distant learning classes and finding that for a distant learning class, the cost of CEUs for acupuncturists to take these CEUs are ranging from $12 an hour up to $25 an hour with different practitioners. And so, basically what that's saying, if one student takes a class, they've paid for their approval fees. So we've been really hearing big numbers throwing around. So I think that there are big numbers that we're not seeing that are part of the CE business that is going on. And that's beside the point here. But the idea of our doing our CE fees are to be able to just keep the operations going and to be able to provide CEs and CE oversight to our licensees. So I just wanted to put that as perspective, and also the perspective prior to my work at the board. I did 18 renewal cycles, so I've had many CE courses, and so I know it from a different standpoint than just from somebody sitting at the board. Thank you.
Thank you, Jay. So, board members, now we hear. I know today we're not going to solve all this. But I just like to hear from the board members, how the next step, and also Ben, what would you like for the board members, to help and support how we want to move forward. Glad stakeholders step in and are willing to work with the board. How we can, all work together on this. Member Kim, please.
Yes, I've heard a lot of detailed impact. I mean, the explanation of this environment for those continuing education providers. And I also said I will be willing to and glad to hear more input so that I can work with this needs and then all this modification according to all this detailed situation. So personally, I admire Lon Brown's ABORM board model, and I realize there is a big impact on this, especially those who have been frequently using through this e-Lotus Academy. So they are the big leaders in the continuing education field. So I think a board should listen and look into what we can do, accommodate to, their needs, and make them sustainable like before, especially in this pandemic.
Thank you, Member Kim.
Madam President, this is Fred Chanyu, DCA Legal. In light of the comments that were made, may I suggest that this item be put back on the next meeting? I want to do some research after hearing what the comments that were made, and I'm gonna do a little bit more research to figure out if indeed there are, there is some sort of, there's some other more information that I haven't considered yet.
Yes, I would like to, please. And Bodia EO, so you want to add some, please?
Yes, madam. Just that I wanted to make it clear to the public, our stakeholders, and the board members, we're not discussing a bill here. This is law as of January 1st. And as much as I've heard associations talk about not wanting to pay a fee, which is unprofessional conduct, to not have the wall license if you are practicing in a clinic. We discussed unprofessional conduct earlier. Sure, the board can't be and won't be in every clinic to make sure that the wall license is up, but you run the risk should a patient complain to the board that you don't have that. And the board will investigate that. Board investigates complaints. Additionally, the continuing education fees are set, like all the rest of the fees that we've reviewed, in statute. Any change to that, even as examples provided from our stakeholders through a regulatory action, will take a regulatory action, which is not immediate. That can take, well, let's just take a look at how many regs we've been working on. And the regulatory time frame is usually 1.5 to 2 to more. So I would highly urge that people be advised of this, as we have been communicating, that this isn't a last second for the board, for stakeholders to claim they're not going to be able to pay anything. And that while the licensees can use credit cards to renew their license and their wall license, the functionality of credit card payments for continuing education providers will not be implemented in our new IT system until later this year. And we're anticipating and hoping that it'll be by June, if not July. At the moment, we cannot tell. Again, we are using an agile methodology to roll out the advancements to our new IT system. And so the full functionality is not here yet. However, we do have good functionality for our licensees, and we are moving forward to providing that functionality to our CE providers as well. Thank you, Madam President.
Thank you. Any other board members would like to discuss this, or? So I would take our legal advisor, Fred has suggested, Ben, we definitely like to put this on the next agenda for the next board meeting.
Certainly.
Yeah, so thank you. And in the meantime, if we get the communications from the stakeholders, so let the board members know if we can help.
Certainly, Madam President. We're going to be clearing out the last legislative requirements that need to be in place for 2021 in the next 2 weeks, and then we will reach out to the board to start working on these items.
Okay, so I have a question about the communications here. Is licensees now is all online, and because I know in the past that they get the emails from the DCA. So how this is worked is all our licensee has been registered, or they get the emails from the board or from the DCA?
For if I captured your question correctly, is how do licensees go through the online account?
Oh, how they communicate, because there was a question received email like a couple of days before the board. I know there is a DCA emails, send it out about the board meetings and notifications, everything. So all the licensees have the access to receive the email communication from the board.
Yes, the board can send emails out, and licensees and stakeholders can send their positions to acupuncture@dca.ca.gov, and just use position on and then whatever the item is, and it will get forwarded to the appropriate place. I'm sorry, did I answer your question, Madam President?
Yes, thank you. So at this point, I don't have any questions on the item 25. Any other board members? Dr. Chen, please.
Thank you, President Mataki. Just as you asked how the licensees can get email notification, as I know, a lot of licensees, they actually they don't know how to contact the board. They don't sign up to get emails. So again, it is association's work, but I don't know if a board has any way to. I don't think we have Facebook or something, social media, some other way. But the best thing is for the association to inform the licensees. You can actually get on the website, get email, get notified. So I don't know if board can do anything, or association should licensees, they suppose fully responsible for that.
Thank you, Dr. Chen. Okay, I see member Kim, and I see VEO Bodia. Yes. Ben, please.
Just to clarify, thank you, Dr. Mateki. All our stakeholders, the public, they're welcome to sign up for the mailing list, and that is done on our website. You just type in your address, and you're added to our listserv, and then whenever we have notices to send out, you're included in it. So that is the easiest way to do that. We don't auto-include all our stakeholders. It's not the board's job we don't send it to 40 million Californians. We send it to those that are interested. The term is technically interested stakeholders, and though the public is always a stakeholder that the board keeps in mind as number one. Thank you.
Thank you. Thank you for the clarification. And the member Kim, please.
Yes, I urged all the licenses. Like I've been attending this 2-day board meeting, and so far I think maybe 50, 60 attendees for last 2 days, and I'm not sure how many of them represent some of their groups. I think it'll be easier for them to be at least informed by any board businesses, because that will impact their practice and also their the protection for the public. So I urge every single association to communicate with the board, and also, if it's possible, have someone who can, understand and represent the board business, and send them to the board meeting. And even now, everything is all over the internet. So I see a lot of different opinions, but I don't think it's representing the majority of those who doesn't get these updates. So I hope things will change next year. Thank you.
Thank you, Member Kim. Dr. Chen, do you want to say something? No? Okay. I saw the hands. Oh, go ahead.
Madam.
Okay. So now let's move to, I think with this item, so we will discuss it here. And then Ben, just as we discussed, we probably can put on the next meeting agenda. But let's move to the item 26, Consumer and Professional Association report.
Members of the public and stakeholders, if you are here representing an association, you are welcome to request to provide an update per the moderator's instructions. And let's go ahead and open it up, moderators, to representatives of professional and consumer associations. Thank you.
This is the moderator, and as Executive Officer Bodea had stated, if you would like to represent your professional association or consumer association, please send us a response and we will be more than happy to give you the floor. First, we have an individual identified as Neil Miller. Your microphone is unmuted.
Thank you, members of the board. My name is Neil Miller, and I am representing CalAtma. CalAtma succeeded in further our work of challenging task of unifying our state's largest and diverse group of licensed acupuncturists. Our membership surged in the summer outreach, followed by a successful annual meeting and statewide election of our new board of trustees in October. We are now the largest acupuncture association in the state. Our election had 26 candidates competing for 11 seats, and we had 87% of our eligible members voting online. Immediately after electing our president, and I have been elected the president, so I'm now speaking as the president of CalAtma, our first official Board of Trustee business was to adopt a non-discrimination policy. CalAtma does not discriminate on the basis of race, ethnicity, color, national origin, cultural background, ancestry, religion, sex, gender identity, gender expression, sexual orientation, marital status, physical or mental disability, citizenship, primary language, or immigration. There are currently 13,000 acupuncturists in California. 11,000 of them do not belong to any association. There are reportedly over 20 different associations. Although I am here representing CalAtma, we are also working with 2 Korean associations, AAAMA and ACAMAC, Japanese association, JAC, 2 Chinese associations, CAMA and AAACM, and CAM19, which is a very interesting online acupuncture association group, and they have 1,700 members. So we are trying to get the message out to as many people as possible and doing our best to try to unite the profession. The issue of replacing the California exam, the CAL, with total or in part with NCCOM certification continues to be controversial and divisive in California, since recent changes in federal programs continue to make NCCOM certification more advantageous. Our Board of Trustees decided to do more research and present a more informed assistance to our members to make a well-informed decision on the best interest of California practitioners, students, and the consumers. We have formed an NCCOM task force. We are looking for to try to find consensus throughout the profession. Our Government and Legislative Affairs Committee has been formed, and we will be looking at both short-term and long-term goals. Currently, the Assembly and the Senate have been completely focused and will be focused next year on COVID-19 pandemic and economic issues. AB 888 that was introduced by Evan Lowe for non-opiate treatments, including acupuncture. We are not sure if Evan's going to continue that bill, but we will be in support of that bill. And if he doesn't continue the bill, we have asked for permission to sponsor that legislation. Our new Board of Trustees confirmed these broad legislative goals to oppose acupuncture being done by physical therapists, athletic trainers, nurses, and other healthcare providers who are not exempt under current California law. And we have a task force and are developing our white paper on this. We would like to change the current scope of practice terminology from Asian massage to manual therapy. As you know, we have been asking the board, what is Asian massage? And so far, for the last, I don't know how many years, no one's been able to tell me. And you understand what happens when you Google Asian massage and the importance of making this change. As I mentioned earlier, 75% of the students today are female. So the practice of this profession is definitely making a big change. And female practitioners are being harassed because of this Asian massage constantly. We have a lot of complaints about it. We will also be looking to clarify our scope of practice regarding bloodletting in our scope of practice and support its definitive inclusion. We'll be looking at laser lights and injection therapy, monitoring federal legislation to expand us into Medicare, which is happening slowly but surely, but it is happening. Discussions have commenced with a top legislative consultant in Sacramento, and I'm really happy to. Well, that's not enough time, so I'll have to ask for a second time. But we have hired a law firm, and we have hired Dario Fromer as our representative for legal and legislative issues. He was a former Assembly member, Majority Whip of the Health Committee, and he was appointment secretary to Governor Davis. Our insurance committee will be looking at reimbursement disparities in the private group, work comp, Medicare, and Medi-Cal veterans and administrative insurance programs. I can shorten it since you've only got 10 seconds and I'm going over. But we have created the following committees. Our California Council of Colleges, our Finance Committee, Conference Committee, Insurance Committee, Membership and Student Committee, Member Benefits Committee, Academic and Continuing Education, and Social Media Committee. Our task forces are mostly related to government and legislative affairs scope, which would be dry needling task force, laser light injections, bleeding. We have a grassroots regional action task force, and consistent with Dr. Lee's, Dr. Youngping, we are looking at cultural sensitivity training as well as ethics and law. We believe that these are really critical task forces with which to have less enforcement issues and certainly to keep our members and the profession from violating things. And that's it. That will rush me through. Thank you for the extra time.
You're welcome. Next, we have an individual identified as Nell Smersina. Your microphone has been unmuted.
Great, thank you so much. Yes, this is Nell Smersina. I'm currently serving as the president for CSOMA. Thank you for giving me the time to provide the updates. So 2020 has been a really powerful year for our organization. We feel as though we're stronger than ever. We saw 30% growth since the shutdown started in March with COVID. We've added 20 new corporate sponsors who believe wholeheartedly in where we're headed as an association. We provided 9 free CEs as a member benefit, which is something our members desperately needed at this time, affordable continuing education, had 9 board meetings, and over 100 weekly committee meetings for our different committees. We wrote 5 formal letters of public comment on major legislative issues, and we organized and hosted 2 national town halls. And our first one really chartered things in March and saw over 5,000 attendees. We did publish our peer-reviewed journal, the Journal of Acupuncture and Integrative Medicine, which has articles about acupuncture emerging in U.S. hospitals. When we're looking at our advocacy and public policy efforts, we have our town halls, which we plan to continue into the new year on a regular basis. We did develop an advocacy agenda, and we plan to introduce legislation to elevate the profession and the healthcare delivery system. Our priorities for 2021, we want to make sure that we do collaborate with the California Acupuncture Board on the sunset review process, any potential legislation that gets brought forward, and practitioner education and training. We're looking to do our advocacy town halls aligned with the legislation going into the new year. And we have some integrative health forums with chiropractors and other allied health providers that we're really looking forward to. Thank you so much for the time.
Next, we have Roy Zhao. Your microphone has been unmuted.
Thank you so much. First of all, thanks the board. Thanks Dr. Amy Mutaki and Dr. Kim, Dr. Yunping Chen. So you guys, the opinions so presentative a lot. The acupuncture providers. So I'm learned from the meeting. Even a lot board member, they don't know exactly the law. After they already written to the law. But I believe the legislature should notice the public for the law change. So that's the first point. I strong suggestion improve the transparency. So I think the board maybe should be the responsibility to help to let the acupuncturist know the legislature, the hearing. The second one is the license fees. So like everybody knows, the examinations fee and the every year's renew fee. So maybe 3 decades and no change. So I'm completely support the change. But for the wall license, I'm a little bit doubt for that. The third one for the CE provider approval fee. So I think the application for the approval of the yearly maybe it's okay, but for the every unit for $10, every hours for $10, maybe it's a little bit difficult to afford for that. So thank you so much. That's all.
Point of order. What was the association being represented by Roy Zhao?
I'm sorry for that. Academic Chinese Culture and Health Science. I'm the VP. Thank you.
Thank you.
Next, we have Philip Yang. Your microphone has been unmuted.
Thank you. Philip Yang represent AACMA. We have updates for our association. First, in December, just last week, we had a new election for the council members, and by January we'll have the new election for the new president and vice presidents. And second is just in the beginning of the COVID-19 pandemic, our association set up an emergency group, the professional group, to do the research and the information collection and strategies of how to deal with COVID-19 and give guidelines or referential information for our members of the RACs. This is a very, very informational, and we follow the guidelines for the governmental guidelines of the policies and also the professional informations. So right now we're still giving the directions and guidelines to our members. And third is AACMA has been always working with the brother associations like CISOMA, COATIMA, and the Korean associations, the Japanese associations, to discuss any new update of the laws and regulations. And also we have the direct contact with the ASA to discuss about the Medicare to accept the acupuncture and the future anticipations and the directions that we work on with, and so on. The next is we pay close attention to CAB's update of laws and regulations and policies, and then we update to our members of the acupuncturists. So we fully support acupuncture board's work and policies and everything. Thank you so much. Thank you for all the board members. So thank you for your hard work. Thank you.
Next, we have Hung Mei Lee. Your microphone has been unmuted.
Thank you. This is Hong Mei Lee, represented California Acupuncture United Association. I'm a provider coordinator. Our provider number is 1811. Since 2020 COVID-19 pandemic, our Acupuncture Association CAVA, CAUA, has been changed to the continuing education with Zoom from April 2020 until now, probably continue next year. So I saw there is a provider fee, renewal fee increased 500. As we know, before it was 150 every 2 years. So I would like to request this payment whether can postpone or reduced to 300. There are two reasons. First is during pandemic, I think 50% of acupuncture clinic closed or reduced their work time. Our acupuncture association also reduced the continuing education fee almost 50%. Second, because the insurance payment reduced from January 1st, 2020. For example, American Specialty Health, every visit pay us before it was $80. Now they reduced the $40 each time. That means 50% reduced. Blue Shirt insurance before the over $100 per visit, now reduced the $48 per visit. Therefore, we request reduce the provider fee from 500 to 300. Thank you.
At this time, it appears there are no other associations wishing to make a presentation. Would you like me to close this feature?
Yes, please.
Feature has been closed.
So now let's move on to agenda item 27.
Madam President, sorry, Fred Chanyu, DCA Legal. I think the public does have a chance to comment on with the presentations. So I would recommend doing public comments on that item.
Okay, thank you for letting us know. So moderator, would you please open up to the public?
At the direction of the board, I have opened for public comment. If you would like to make a public comment in regards to agenda item number 26, please submit. I would like to make a public comment and send to all panelists. I will pause momentarily to allow individuals time to access this feature. We do have an individual identified as Kai Ping Tang. Your microphone has been unmuted.
Okay. So I have a concern about the tutorial program. It used just the application fee is same as the license fee, and then the training is 50. Right now, it's like 100 times more. The applications like 1,000 or less than 2,000, or the renew fee is 500. You know, this is like for the supervisor is a free labor, and then for all those training, they have all kind of difficult situation. That's why board keep this program. I think during the pandemic, this is not a good time to increase that much. It's very hard for those students, also for the supervisor, you know. I think this is too much and without notice too. So we have a big concern for that. We strongly suggest to postpone this fee increase dramatically. Yeah.
We have received no additional requests for public comment. Would you like me to close this feature?
Yes, please.
Feature has been closed.
So let's move to agenda item 27. Future agenda items. Board member, what would you like to see as a future agenda? And please go ahead.
Nothing from me, Madam President.
Thank you, Chair Harabidi.
Point of order, let the record reflect that Member Harabidian has returned.
Thank you. Other board members? Member Kim, please.
Yes, as I mentioned yesterday, I'd like to make a suggestion to discuss on clinical training. Standard or other aspects of this training in this pandemic time.
Member Kim, your connection is breaking in and out. What I captured from you yesterday was to review clinical training owned and operated by the school and set that up as a regular regulation, proposed regulation. Is this the same one? Okay, yes.
Thank you. Thank you, Ben.
Mm-hmm.
Other board members? Yes, Dr. Chen, please.
Thank you, President Mateki. So I have two. One I mentioned yesterday about the telehealth. So we have the staff did a good job, and to see if next board meeting are we going to vote for the telehealth. So that's one. Number two. So yesterday we heard a lot about in this pandemic. Pandemic is unfortunate, and last big pandemic was 1918. So fortunately, we don't have every 102 years get one. Hopefully, we don't get this bad one anymore. Anyway, so. It's natural and the medicine. I think the last board meeting I mentioned actually traditional Chinese medicine developed in a lot of pandemic. So pandemic itself is very damaging, but meanwhile it promotes the development of the medicine. So of course, for Western medicine, vaccine the highlight can help to prevent. But for the acupuncture profession and the oriental medicine, during this pandemic, we saw the necessity of the telehealth, and we saw the benefit of the telehealth. And the telehealth part mainly actually is the oriental medicine part, not real acupuncture, not face-to-face but needly. So, so from this, the consumer's needs, I see there's space for us to fill up, to further do research about the oriental medicine part, including herbal medicine, Tai Chi, Qigong, nutrition, exercise. I think it will bring you better benefit the consumer. I know some acupuncturists, they have to close the clinic, but meanwhile, some other acupuncturists, they are doing a lot of service to the patient to help relieve the symptom associated with COVID-19. Because a lot of people, most people, they cannot go to hospital. They don't have access to hospital unless their the oxygen number dropped down to 94, and the fever going to a certain degree, the symptom really bad, develop to have a pneumonia, and most people stay home. And those people, they don't really get sufficient information about how to take care of them. And they really, so the acupuncture profession or oriental medicine is a good part to fill this gap.
This is hi, excuse me. This is Fred Chan, UDCA Legal. I think the item on the agenda is to discuss what items to place on future meetings. So, is your proposal to put an item that is related to how to combat pandemic on the next agenda for next meeting?
It's not a okay. Sorry. I like to clarify. I means actually from this pandemic give me an inspiration or an idea. I see the needs of the oriental medicine, so do some research or the minimum competency of or maybe the school can we can maybe monitor or have some oversight for the people to use, for the professionals or people to use the herbal medicine for safety purpose.
Thank you, Dr. Chen.
Point of order, just for clarification and clear identification of the topic. Are we looking at the regulation of herbal medicine? Is this the topic you're introducing here, Dr. Chen?
Yeah, yeah.
Okay, thank
yes.
you. So noted.
But yeah.
Yes. Thank you, Ben, for the clarification. So let's go to member. I see Mr. Soriel, please. And then next one, I believe, is Shudong. Dr. Lee, you're going to say something. So let's start with Mr. Soriel.
Thank you, Dr. Mateki. I also like to bring out the to put on the agenda the use of credit card, if I may, please. So the customer or the patient, I mean, so that they can pay with a credit card.
Thank you, Mr. Osorio. We can make an announcement of it, but are you looking at for them to pay for a credit card on services that will be rolling out that would, I'm sorry, what services we have available to pay by credit card?
Yes, to make it easier for the also, I think the transactions on checks, it also it may even reduce time. It's more consuming than using a credit card transaction.
Mm-hmm. Okay, thank you.
And I also agreed in another one, the herbal medicine. If we can bring that up, I agree with Dr. Chen on some of what she said.
Noted. Thank you.
And that's all I have to say. Thank you.
Thank you, Mr. Soro. Other board members?
Madam President, I see Member Osorio and Member Chen with their hands raised.
Yeah, that's early. So Dr. Chen, okay. What about Mr. Osorio? You want add? Do you want to add?
No, I am trying to take that out.
Just click that hand. When you
Yeah,
click
I'm trying to find it. I'm using a different computer and it's a different way. So I'm trying to do that. Thank you.
Thank you. Sure. Any other board members who would like to have future agenda items? No? Okay. So, Ben, if you're okay, I'm going to open up to the public.
Please, Madam President.
Okay. Yeah. Thank you. Moderator, would you please open up to the public for the future agenda?
At the direction of the board, I have opened the Q&A panel. If you would like to make a comment regarding possible future agenda items, please type "I would like to make a comment" in the ask field and send to all panelists. All comments will be taken in the order they are received, and you will be provided 3 minutes with a 30-second warning. First up, we do have an individual identified as Neil Miller. Your microphone has been unmuted.
Thank you, members of the board. I'd like to say that I really appreciate the board. You know, we're at the end of this meeting, and there's been a lot of emotions today. So I just wanted to take a deep breath and let you know that I, and as a representative of our association, do appreciate the hard work of Ben and his staff. And where we may disagree on certain issues, we are not combatants, that we are all stakeholders. Having said that, I would like to wish everybody a safe and healthy holiday for the new year. I'd like to discuss, we would like to have on the future agenda items, and I'm reading from the last, the minutes from the last meeting, where we'd like to talk about Asian massage, bloodletting, dry needling, and lasers and light. But I would, which we've been going on and on, and we'll leave it at that. But I would like to reach out to Mr. Harbedian's committee. I'd like to have a level of competence discussion. I believe that the minimal level of competence that is necessary in today's world has changed. And you hear so many people clamoring about getting more education, getting more education. All of these acupuncturists are looking for more education to try to keep up, way more than the 50 hours that is needed every 2 years. I've been in practice 30 years, so I'm telling you that more education is needed on the front side. If those who are in practice are telling you need more education, think about the disadvantage of those who are in school. The minimal level of competence has to come up, and the schools that were opposed to raising the hours or having a doctoral program all have doctoral programs now. So I would like to put on the research and education committee a look at how we got to where we are now. Let's look at previous things that the board's curriculum competency task force and education task force and all the work that's been done before that shows that we need more education. Let's take a look at that. Let's discuss with the stakeholders what we think. And the state, I think that we could do a much better job. I think that the things that Dr. Ping wanted to address in terms of raising the standard in terms of herbs and this and that and the other could be addressed at that time. Thank you again to all board members and to Dr. Mataki for doing a good job, and to Ben and his staff. Like I said, we do argue, but we do really appreciate what it is that you do. Thank you very much.
Next, we have Michael L. Fox. Your microphone has been unmuted.
This is Michael Fox, and I would like to reiterate and bring to a future agenda the issue of laser acupuncture. This is an issue that I brought to the board and spoke for a long time, 11 years ago and several times. Based on the Hoover Commission and several delineated studies by the Acupuncture Board, the only objection by the California legislature was that the FDA, the FTC, had not yet regulated and brought to a mainstream medicine the idea of laser acupuncture, and that has since been refuted. In 2009, 11 years ago, this was adjudicated. And so the only issue that happened 11 years ago was that the California Acupuncture Board had not yet approved it. The federal regulations had approved it. So I'm going to say to you guys, let's look at this again. Let's bring this forward. And in this style of many other states, let's bring this back into the scope of our practice, and let's recommend this to the legislature. We need this to protect the consumers. We need this to be able to benefit our consumers. Laser acupuncture has been around for a long time, and we should be able to provide this to California consumers. Thank you very much.
Next, we have Dylan Stan. Your microphone has been unmuted.
Hi. Just following on the past comment, I do want to say thank you very much. You know, we've shared a lot of comments with you today, and we really appreciate you listening to our concerns. So I, on behalf of Net of Knowledge, and I'm sure as we all know now, eLotus, Pacific College of Health and Science, and Healthy Seminars, would all strongly request that the issues that we've raised today be added to the next agenda, particularly our letter, what's covered in that letter, and also our proposal for a bulk discount rate for renewals of previously approved courses. Ben, thank you for commenting on our points, and I see that you're also aware of that legal reference that we were making that does give the board the final control to adjust the fees through regulation and not the legislation. I personally don't know how long it takes to pass regulations, and there's a big system around it. So I would just request that you hear our urgency, and like I said, we're not concerned about ourselves as businesses. We'll simply adapt. We care about the practitioners that are taking our courses. We are doing this for the love of the knowledge. We care about our teachers that are teaching on our platforms. This is why we do it. There's so many different things we could do. This is why we do it. So I hope that you see the urgency, and to answer Fred Chan, just so you know, Chan Yu, the legal point that you asked me about, it sounds like Ben found it. It was actually the fee reference that you keep referencing is subsection N, paragraph 1 of section 490. Prefacing that entire section actually says that the fees can be lower if the board chooses to pass a regulation. That's only one option. I think the board has other options. Like I said, I think that subsection N, paragraph 1 and 3 have a bit of flexibility, because I know the board obviously wants to support the industry, wants to support teachers, wants to support practitioners in whatever way they can. And if you choose to, you could perhaps interpret points 1 and 3, even respective of the overall subsection, or the overall section 4970.
30 seconds.
you could actually probably work with the wording of the existing 2 points in that legislation and implement a separate fee schedule. So that's all in our letter, and I hope you get the chance to read it. If you haven't seen it, please ask. Jay and Ben both have that letter, so I thank you so much for your time.
Next, we have Kai-Ping Ting. Your microphone has been unmuted.
I'm still concerned for the tutorial programs issue, you know. So I already mentioned one time, the fee is too much for supervisor and the training. Yeah, that's a big problem. So I suggest board can reconsider this issue.
Next, we have Yoon Kim. Your microphone has been unmuted.
Thank you. I would really like to thank Dr. Moteki, the chair, and the EO, Ben Bodia, for all of your hard work. We really, really appreciate the board and your partnership with the stakeholders in the field. And I really want to support all the comments that have been made regarding the implementation of the fee increases. It goes without saying that every member of our profession has suffered and has been affected by the pandemic, including the schools and the licensees especially, and the students, and really urge the board to consider postponing the implementation of the fee increases until the end of the pandemic. Many licensees and alumni have reached out to me, speaking to the hardships they have experienced, and just adding these increases this year and next year doesn't seem to show a lot of compassion for what our licensees especially are going through right now. We need a stimulus, not an increase in our fees, especially during this incredibly challenging time. So again, I really urge the board to reconsider and to consider a postponement of the implementation. Thank you.
Next, we have Lauren Brown. Your microphone has been unmuted.
Again, as we close this meeting, I want to thank the board. Having sat on boards and watching what you guys are doing, it can often be a thankless job and it takes a lot of effort. So thank you for taking this position and thank you for hearing us today. I would like to have added to a future board meeting the credit card issue about accepting payments online versus going to checks. I reiterate the question about laser acupuncture, having that addressed on the board. Being a provider and a practitioner uses lasers. Other states, the lasers are very popular, and it will benefits the patients because of the effectiveness and the safety of it. That physios are using it, chiros are using it, massage are using it, and many acupuncturists in other states outside of California are using it. And so I would love to be one of the stakeholders. If you want to have me as part of that discussion, please put that on your agenda. And again, just reiterating what Dylan and the others have said, is we're looking for you to revisit the renewal fee. Again, we are not saying you need to change the law, because we think the way the law is written, it allows you the leeway, the flexibility to adjust that one section. When we look at the revenue stream for the board, which it does need for solvency, we can appreciate this. Your number one revenue source from CE will be the new course application. You had 781 courses just in the first quarter. The second fee would be from the renewals if you use a bulk rate. And the third would be your $500 every 2 years fee. So we are not taking money away from you. We know you'll have the solvency, and it will allow us to keep our libraries available to California. Our libraries will exist. They just won't all be available to California if you implement your policy as is. So we would really stress, because no board member has put it up, only publicly we've asked, that become a priority on a board meeting. The renewal fee for providers.
Next, we have Hongmei Lee. Your microphone has been unmuted.
Thank you. On the end of the meeting, I would like to thank you, Dr. Mataki, Dr. Chen, for organizing this board meeting. And thank you all of the board member, hard work for all our acupuncture in California. I hope in next board agenda, California Acupuncture Board member could have the answers for our questions for item 25. Thank you.
Next, we have an individual identified as Sarah Jacobs. Your microphone has been unmuted.
Thank you. My name is Sarah Jacobs, and I'm a Deputy Attorney General. I would just like to quickly introduce myself to the board. I have been appointed as the liaison from the Attorney General's office for the Acupuncture Board. And as a quick background, I have 11 years experience as a criminal prosecutor for the Attorney General's office and have been in HQE for approximately 2 years now. And I'm just grateful to be able to hear the board via on the web. And I just wanted to let you know that I am here.
With that, there are no additional requests for public comment. Would you like me to close this feature?
Yes, please. Thank you.
You're very welcome. Feature has been closed.
Thank you. I just wanted to thank everyone today. And first with Sarah Jacobs, thank you for being here to sit in, listen to everyone here today has been very involved and engaged the discussion with the board, and I appreciate the stakeholders has been working with the board for the last few years since I've been in, and I'm very grateful to the staff really under the leadership of our EO Executive Officer Ben Bodia. I don't remember this year he even take a day off. So I just wanted to say is everyone has been working really hard for the hardship, and we absolutely hear what you has voiced. And our legal Fred will working with us, and also DCA's office has been working with this board very closely. So we, will work through this, and we are here to serve you, the stakeholder, and also to protect the public. I just wanted to add this. This is really a most difficult time for everyone. So appreciate it, everyone here for the last 2 days, and our board members has been very diligently. Committees has been working very hard also, and thanks to the chair Harry Beating and Chair Osorio on the legislature legal part, and also the examination of a Vice President Kimman. So I grateful for the board has made progress. Bang with your staff, Jay and Christine, and also the staff being on the line today for all your hard work, and thank you. So I don't have anything to add. Bang or any other board member wanted to have any final word to say? Otherwise, we're going to move to the item 28.
I'm good. Thank you for the opportunity, Madam President. Everybody stay safe this holiday season.
Thank you. So this is the final, and we will adjourn, and the board will meet on the March 24th and the 25th next year, 2021. So the meeting adjourned at 3:11 p.m. Thank you, everyone. Have a safe trip and travel if you do, and maybe not, but have a wonderful holiday. Thank you.
Thank you, Madam President. Bye, everyone.